If you are told that your diagnosis is osteoarthritis of the knee, there are several treatments that can be utilized that are non-surgical in nature. The first thing to understand is that there are two types of cartilage in the knee. One is the white glistening cartilage that lines the ends of our bones. That's called the articular cartilage, and that's what's involved in osteoarthritis. The other is the meniscus cartilage, which is a C-shaped cartilage that serves as sort of a gasket or a shock absorber between the femur and the tibia, the thigh bone and the shin bone. It's important to understand that osteoarthritis is largely a degenerative disease. In other words, it's a condition of cartilage loss and secondary changes in the bone that patients have really no control over. It's typically genetically programmed that can occur during the time course of our lives. Now, certainly trauma or previous surgery can lead to the development of arthritis in a premature setting, but most patients develop it as we age. It is less about what the MRI shows or the X-ray shows and more about what you feel as a patient in terms of the pain, swelling, and associated inactivity that you have because of your osteoarthritis. One thing that we've learned is that the participation in activities has not been shown to definitively increase the disease that patients have when they are diagnosed with osteoarthritis. In other words, I don't typically ask patients to restrict their activities because of concerns that the disease may get worse. More importantly, activities may escalate a patient's symptoms, but that's not synonymous with making the disease worse. Patients with a known diagnosis of arthritis in the absence of symptoms, in my practice, are free to engage in any activities they wish, because there is insufficient data that shows that those activities will cause that disease to progress. If a patient is struggling and would like to do more with less symptoms, we have several options. We can ask you to reduce the activities that you participate in so that you can tolerate things better, or we can create an environment to expand the ability of your knee or your joint to engage in those activities with fewer symptoms. Mostly that involves utilizing non-surgical measures. There are many treatments for osteoarthritis that are non-surgical. They involve slight activity modification, potentially the use of injections, physical therapy, orthotics in your shoes, bracing, a holistic approach that could involve glucosamine and chondroitin sulfate, undenatured type 2 collagen, turmeric, vitamin D, and other nutritional approaches. There isn't any data that these treatments will regenerate cartilage, but they might reduce symptoms of pain, swelling, achiness, weather-related change. Our treatment algorithm is to consider corticosteroid injections or steroid injections first, as long as the symptoms are appropriate for that treatment. If that's been tried and patients get less than 3 months of relief or no relief at all, we then move on to secondary recommendations, which might include hyaluronic acid or a lubricant. Patients will also be asked to consider the use of platelet-rich plasma at the time of the hyaluronic acid injection. The process involves getting pre-certification for the lubricant, and then there is a small out-of-pocket expense for the platelet-rich plasma. There's 3 injections given over a 3-week period. Should you opt to consider hyaluronic acid without platelet-rich plasma, then a single injection of hyaluronic acid in a different formulation can be particularly useful. These are discussions that we will have in the office. All of these treatments are designed to modify symptoms, but not the structure of your knee. If I can make you have fewer symptoms and become more active, then we can ignore the findings on your X-rays and MRI. And I would impose no limitations on you. Our objective is to do the least amount necessary to modify your symptoms to make it so you have less pain, less swelling, and more function.